Hey everyone, this is the recording for the AMBC 110 Week 2 live session. So if you watch this recording and if you complete the quiz that is embedded in this recording, then you will get your participation points for Week 2, as long as you are logged into Canvas when you view the quiz. That way I can see your name, automatically shows your name that you've completed the quiz, and I will get you participation points. So Week 2 we're talking about healthcare data sets and standards. This quote here says, "Chronic conditions are the major cause of illness, disability, and death in the United States, despite the fact that much is known about how to prevent chronic disease and delay or avoid many related complications." And this is from a document called Using Computerized Registries in Chronic Disease Care. So this relates to our case study, because diabetes or diabetes case study, this is a chronic disease that really in a lot of situations it can be prevented. So the focus on preventive care is really important. Last week we had talked about a few different things. One of the things that was mentioned was creating a Study Buddy link. So I created that Study with Friends area that's in the course hub. So if you go here, it is right up here under the course hub, and it says Study with Friends. And you guys can actually, talk back and forth on here, and then when you're ready to do a Zoom session, you just click right there on that Zoom link. So that's there for you to use. So from week 1, we had talked about the first few questions in this diabetes case study. There was a little bit of confusion. I got a couple questions after last week's live session because a couple of things had been changed since last module. I think I'd mentioned some of the changes, but if I mention anything about Sue and the case study, I apologize because that information was changed, and now it's just kind of the case study is focusing on you in this person's shoes, basically. So everything else is still the same. The questions are all the same. These are the week 1 questions that you had to look at and complete for week 1. So for week 2 in this case study, it talks about some required reading. One of those required articles was from healthit.gov. It talks about who are the key stakeholders during the EHR implementation process. So this article talks about the staff members that should be involved in the EHR implementation process. So some of the ones listed, these are not all of them, but some of them were the nurse lead, physician champion, EHR implementation manager, meaningful use lead, and super users. Those are some of the main ones. Physician champions are extremely important. A lot of doctors or providers are, they're kind of slow to adopt an EHR. They don't really want any changes. A lot of them are weary of change, especially if they're used to doing things a certain way. So having a physician champion, being the physician champion to kind of promote the electronic health record transition. For other providers to kind of see that they're involved and to hopefully get them to be involved as well. So that's really important to have a physician champion with the EHR implementation. EHR implementation manager, basically someone to get everything ready to kind of organize the project. Whether it be gathering information from the vendors about the EHR software programs, getting those requests for information, requests for proposals, that sort of thing. They would be in charge of that. Meaningful use lead, this goes right along with the EHR, making sure that whatever EHR program that they decide to implement is meeting meaningful use standards. They could have somebody just focusing on that. That's really important with high tech and all these changes for meeting technical requirements for being able to send information, being able to send that information electronically. Someone to kind of focus on that. So super users are staff. So staff that's trained in using that electronic health record, and then they go and train all of the other staff. So they're going to be considered super users, and that's also called train the trainer. That's a method that's used with electronic health records. So the next required article that you are going to be looking at is called Building a Computerized Disease Registry for Chronic Illness Management of Diabetes. And this talks about how we can identify patients to be used in a diabetes registry. For example, patients, we can look at lab results, those with high glucose levels. We can look at ICD-10 diagnosis codes, kind of pull some of those diagnosis codes that show that they're patients with diabetes, patients with complications from diabetes, all of those can be pulled. Patients that are on diabetic medications, they're going to be included. Information from medical record notes, you can find them that way. And then this kind of goes with this part, where would you get this data from? What are some sources of data in healthcare? So we would be pulling this information for patients in that diabetes registry from basically the medical record. It could be a paper record, an electronic health record, and specifically within the record we could look at the lab results again. We could look at doctor notes to say what the diagnosis is, what their medications are, medication lists, and then problem lists as well. So any of those you can gather that information from. This says healthcare teams that have access to a registry can call in patients with specific needs, deliver planned care, receive feedback on their performance, and implement reminder systems. So those registries are extremely important in healthcare. Still talking about registries, what is a disease registry and what are its functions? Disease registries are made to capture information regarding patients with a specific disease. So for example, we're talking about a diabetes registry with our case study. It's going to track patient diagnoses, patient treatment, any follow-up given to patient, or any follow-up not given. Probably going to track provider information on those patients in the registry. Tracking outcomes. And all of this in hopes to improve care for those patients, and hopefully improve treatments and possibly, eliminate or decrease that disease in the future. So these are your week 2 questions that you're going to need to answer. Just 2 of them this week. 300-word minimum, they're worth 50 points. It says, how can the role of a biller and coder assist with these data quality concerns? And do you think you'll have any issues with data standards? What specific data standard issues do you think you need to address? How might you address these issues to mitigate the risks? So when you're done reading the week 2 reading in your case study and looking at those required readings that we just went over, you're going to answer those 2 questions. So moving on to your week 2 discussion question. This is about the Microsoft Health Vault. Microsoft Health Vault is a personal health record that was created by Microsoft, and just kind of thinking about Microsoft and how they're not usually doing anything in the health field in relation to the health field, what are some things that might come up? What are some concerns that might come up in that sense that they're not really used to venturing in that area? This is a video on Health Vault, and I want you guys to watch this. I'm going to send this out in the Google document. I don't think the volume has been working on this recording for videos, so I'm just going to have you guys watch that if you need to know a little bit more information about Health Vault to answer that discussion question. So what is a personal health record? Okay, I do have a sample response if you're having trouble coming up with an answer for that Health Vault discussion question. You can look at that if you would like. You have a data set matching assignment this week, and it's a little bit challenging. So I created a Quizlet game that you guys can go in here. You can actually open with this link, go in there and play a Quizlet game to kind of study up on some of those data sets. Because they can get confusing, and This is a good way to kind of get an idea and a better understanding of those data sets by playing that Quizlet game. So why are data sets and data standards important in healthcare, and what are some of their benefits? So moving on here, there is a pre-class activity. It talked about the flow of data. If you got a chance to watch that, that's awesome. If you didn't, you still have a chance to this week. It kind of asks a few questions. This is not for points, but this is just for you to get a better understanding of the flow of data. And that's that link to it right there. The next thing I'm going to talk about is types of users in the medical record. So who is going to be using the medical record and that data in the medical record? Who would need to be using it? Or what are some of the uses of it? So this picture right here kind of shows some of the ways that it can be used. I have patient care. This is the main purpose of the medical record. It's the main purpose that data is collected. Research, another huge reason why data is collected in healthcare. Information in the medical record can be used for legal purposes, such as if there's a subpoena, if you had to bring that medical record into court. That's another use of the health record. Auditing, so for example, if you're being audited by the Joint Commission, they would need to look at your medical records. Performance improvement, this can be something within an organization. Something they're working on certain process improvement methods, they can look in the medical record, try to keep track of certain things for that. And also for reimbursement, for services provided, getting reimbursed for those services. This is another important use of the healthcare record and healthcare data in the record. So this week we're reading chapter 4. You guys have a drill, a check your understanding drill. You have that flow of data pre-class assignment, and then that's not worth points again, but it's helpful and it's interesting. And then you have your discussion question, which we had talked about. This is your discussion question where you're talking about Microsoft Health Vault. So again, I have that sample discussion question response on here. And also that video, if you get a chance to watch that video, it explains more of what Health Vault is. And then your data set matching assignment, which is worth 30 points. And again, you have that Quizlet link on there to kind of help you study up on some of those data sets before you take that quiz. And you have part 2 of your diabetes case study where you're just answering the 2 questions this week. And you're reading those required articles that I discussed. And again, for participation this week, again, you're watching this video and you are taking the quiz that's associated with this video, and then you'll get your participation points. So everybody, thank you so much. Have a good week, and I'll see you next week.